I'm delighted to say that I've been joined today by Councillor Mary Rimmer. Mary, thank you for taking the time to speak to Holton and St Helens VCA. Welcome to the Healthy Blog. How are you today?
Feeling very well, apart from going through this interview.
You had a very healthy breakfast, which quite inspirational. Really, normally we just chat about that off air, but I think you're obviously living the health mantra, so to speak.
Well, I try to, but one wouldn't see it. The evidence isn't there to support the activity that's put in. You know, I also bring a box of salad with me for lunch every day. You know,
well, we're on our way to McDonald's, so you're wiping the floor with us, anyway. Some of the people watching this interview today, especially voluntary groups in Holton, won't have had the opportunity to meet or hear from you before. So before we talk specifically about health matters, would you tell us a little bit about yourself and how you became a councillor here in St Helens?
I used to work at Pilkington's, which most people did, or lots of people did in St Helens. Yeah. And I was responsible for setting up the trade union for the white-collar sector in Pilkington's. And naturally through that and through community work, helping a disabled older lady in my area, led me into looking at what could be done to improve the life of people in St Helens. And from there I joined the Labour Party and just became a councillor. It wasn't planned. No. It just happened. And I've been here since 1978.
Wonderful. I always think the great local politicians are the people that don't want to be local politicians. Yeah. They just want to have a positive impact in the community. Yeah. Mm-hmm. And how about your role now as leader of the council? What kind of activities does that involve?
Well, it's a very busy life. It's also very rewarding and challenging. You're never short of a challenge in this role. But basically, it's about promoting and working to improve the quality of life for people in St Helens, in this borough. And in order to do that, it's quality of life in every area, like environment, health, education. It's about doing your best to ensure that people get the best out of their life. So there's lots of different bodies that you sit on and you build up networks of people. There's lots of different networks, partnerships that are about working together to improve the lifestyle of people of St Helens. And
you mentioned it's a very challenging role. Is it a rewarding one?
Very much so. I always say a councillor's role is voluntary because you do volunteer yourself.
Absolutely.
You don't go like seeking employment and get appointed or anything like that. You put yourself forward. Yeah. And of course it's very rewarding if you see we see education results improve and you think, well, you've had something to do with that. Or you see the new hospitals being built, you've had something to do with that. It's really rewarding. You think, well, I can see something I've done here.
Absolutely. I think sometimes there's a hangover from the 80s where the statutory sector and the voluntary sector are seen as almost competition for each other, when in truth I think it's a very natural partnership because we're all working to the same goal, which is to make things better for the community in St Helens.
Well, my philosophy in life is to work with people. Yeah. I think partnership working, it's very often used as a cliche, isn't it, partnership? But I genuinely do believe by working with people and respecting other people's roles, seeing what they can offer, other people can offer, what you can offer, you can usually improve things for people. So it's not about competing. Yes. It's certainly about helping others and them helping us as well. Absolutely. We haven't got everything here.
Of course, absolutely. Now this is the Healthy Blog, so we are here to discuss health matters. The health framework is changing nationally and locally. What does this mean for St Helens? Well,
the scale and the pace of the change in health services could be frightening. It's absolutely enormous and brings many, many challenges, and not only for those people working in the health service, but it also gives us an opportunity now, because of the change in the framework, because of the demise of the primary care trust and the setting up of what is now our shadow health and wellbeing board. It gives us, the council, And I think the voluntary sector, tremendous opportunity to help to improve health services for our people out there, and to improve healthy lifestyle as well.
Absolutely.
So we've got like the councillor will be taking control of public health again in April next year. We've already got our director, Liz Galton, and we've got a cabinet member, because we see public health as being vitally important. A lot of that is about preventative health, healthy lifestyle. So we'll have a real opportunity to use council facilities, council connections to improve the lifestyle. Then we've got the Health and Wellbeing Board. It's like where everybody who's got anything to do with health will meet and does meet. We've got the voluntary sector. I prefer to call it third sector, because yes, there's lots of volunteers, but there's also lots of employed people in there.
Absolutely.
But we've got the voluntary third sector there. We've got the doctor representatives and the GPs. We've got links, which is connected to people outside. We've got the councillors and officers with the skills and knowledge to work together to hopefully come forward with good strategies and develop commissioning opportunities.
So would it be, I mean, if people are watching this from voluntary organisations that haven't heard of the Health and Wellbeing Board, would it be fair to say it's the great and the good, everyone who's got an interest in the provision of healthcare services getting together and working out together the best strategies?
Well, put it this way, I'm the leader of the council and have been for many years, over a period of time. But I've never, prior to the Shadow Health and Wellbeing Board, I've never met doctor representatives. I've never had the opportunity to put forward my views, and for me to listen to them. And already you've got the commissioning bodies and social services. They do work with the health services, but it's about bringing everybody together, like social services, like GPs, hopefully in future the hospitals, the voluntary sector, people who deliver caring, domiciliary care, bringing them together and hopefully building a more joined up, cohesive service for the recipient, and about improving life, you know.
Definitely. And I suppose there must be a great deal of expertise around that table, as you were saying.
Well, there is a lot of expertise around the table. It's quite amazing that you listen to someone and you think, surely we could make that easier for them if we did this way. And I'm sure they think the same way. And really what we should all be about, and what we are about, is ensuring people have a healthy lifestyle, to prevent illness, to promote good, healthy living standards, to ensure that people get the health care that they need as close as possible to home. Absolutely. And that it's as comfortable and as least daunting as possible. And then if they have to go into hospital, that they go into hospital, it's a good hospital and they get good health care. But it's about us working together, not about us like, we do this, you know, and we're keeping this.
Exactly.
It's about what can we do to make it better for the recipient.
Absolutely. Because at the end of the day, all of our, whatever the word you use, whether it's beneficiaries or service users, it's all the same people. It's the local residents, and that's...
We're here to serve the same people.
Absolutely. You've mentioned that the voluntary sector is represented within the Shadow Health and Wellbeing Board. What have they set any local priorities yet? Are there any areas that they're going to be concentrating on?
Well, we're just in the process of setting up our first strategic plan.
Okay.
But yes, we do have priorities already. We know dementia is a real problem.
Right.
And unfortunately a growing problem. More and more people suffering. So that is high on the list.
Okay.
We know that obesity is a real problem. And it's not just about being obese, it leads to more diabetic and all sorts of health problems. We know that the health service spends 10%, National Health Service spends 10% of its budget on diabetes, so about preventing that, it's got to be good, hasn't it? Because it releases funds for other things. And that. So, yes, we do have priorities and we're working together, but elderly people, we're all living longer. A lot longer, and with many, many more complex needs and health problems. So we've got to work together about how we can keep people in the homes
Yes.
if they want to be at home for as long as possible, but with a quality of life, not just existing. And that's where the voluntary third sector has a big role to play.
Right.
Even now, and have done for years in St Helens,
Yeah.
they've had contracts with the council to provide domiciliary care, sitting services, leisure opportunities, weekend breaks, social activities and that. So this, it's really interesting.
It is. And organisations like Willowbrook Hospice, of course.
Oh, yeah.
National example of best practice, one
Yeah.
would say. Organisations, I suppose, Age Concern Mid Mersey, of course, whose office is just down the road.
Yeah, yeah.
So that's pretty exciting. So it isn't just that you're saying, give us your feedback or you chip in. There are potentially contracts going to be handed out so that third sector organisations can actually help deliver these strategies.
They'll be part of delivering the strategies on the Health and Wellbeing Board. It's shadow at the moment, but it will be full. But they will be part of setting the strategies. They've got tremendous knowledge, understanding of the communities and the needs. They're, I think, perhaps you can say, sometimes closer to the public, because perhaps the public feel easier that they're not talking to officialdom when they're talking to the voluntary sector.
Yeah.
I mean, people said to me, like, Crossroads or Cllr, they're really good, they do this, and I know for a fact they don't know that there's a contract there with the council. They don't see them delivering it for the council, so they see them as different. I think there's still a thing with the public about the council being the authority, or the health authority and things like that.
Yeah. What do voluntary sector groups need to do to be ready to be commissioned to provide services? What steps can they take, do you think?
Well, they've got to be open to the challenges that are coming forward, because the financing is going to be very, very difficult. The health service has got real problems finance. They've got 20% cuts to find. We have problems with our hospital funding at the moment still. We're not sure on that yet. But there's lots of opportunities for the third sector, voluntary sector, for these contracts that will be coming forward. They need to be involved in setting up. They need to be flexible. Perhaps even more so flexible. They are flexible, but they need to be flexible. They need to be not competing with each other, but working together. And in fact, we all need not to be competing. Yeah. We all need to be working together and be more efficient as we possibly can to get the best out of the resources we have available to us all to serve our public. Absolutely. And I am confident, even with the financial restraints, that working together, we will deliver better. I am absolutely confident of that.
Wonderful. I think that's an excellent place to end our interview today. But before we go, is there anything else you'd like to add?
I'd like to thank the people that's been involved in the Shadow Health and Wellbeing Board up to now. I think we all met and thought, what's going to go on here? But there's been a very healthy, friendly working relationship developed. Yeah. You've seen the barriers going down. Yeah. And I feel as if I understand much more having sat on that from the different bodies, and I know that other people feel the same way. So we're less frightened of each other. Yeah. We're more like, here we are, we've all got the same job here, let's get on with this.
It's a challenging time, there are challenges ahead, budgets are obviously a problem, but we're approaching it in the right way, and together hopefully we can tackle some of these issues.
I'm confident that we will, as with the council, the health services, the voluntary sector, working together. I am absolutely confident that we will improve health, lifestyles, people in this borough.
Councillor Rimmer, thank you so much for taking the time to talk to the Healthy Blog today.
Welcome.